She is as comfortable with a stethoscope in her hands as she is a fishing rod, gardening tools, and needlework. As the Chief Executive Officer of the Bond Community Health Center, Dr. Temple Robinson, for almost 2 decades, has been building relationships between diverse sectors of the Tallahassee community, but never forgetting the importance of patience and timing.
I'm still practicing on patience. I hate to wait for anything. I want to get it done. I visited my mother a couple of weeks ago. She lives in South Carolina, is where I was raised. And she said, you know what, you could never wait for anything. You would ask, can I go to the so-and-so activity? And I'd say, well, we have to wait and talk to your dad. And you say, I can't wait. And that has been an Achilles heel for me my whole life, waiting. So I do things to try to improve my ability to be patient. I stitch when I travel, and I bring some of the memories back. So this is St. Simon's Island. I find the rhythm of stitching, whether I'm knitting or needle pointing, if I can get in a cadence, not only does it help me relax, because you're not supposed to do any of this stuff if you're frustrated. That's a secret. You never stitch if you're angry or frustrated, because your stitches will be pulled too tight. And then when you come back to look at your work, everything is distorted. And when I really need to just come and think and reflect, this is where I find my peace. And I come in and I relax, I stitch, I think, I dream. This is the dream room. So, you relax first, then you get in a cadence of whatever it is you're stitching on, and then you realize the value of patience and waiting. You can't stitch anything overnight, not to have it look like something. So it brings me great joy, and it also gives me great discipline. So these are some of the patterns that we use when we're knitting, especially if you're knitting lace. Something like this has a lot of beads in it. And you have to take your time, just like in medicine, just like in life. When you think about needlework of any type, the attention to detail that is needed to get things right. But in medicine, we can't afford to be wrong very frequently. We all make mistakes, but it is the attention to detail. If you are palpating a patient that's feeling for lumps and bumps and things that shouldn't be there, what do you see? What do you feel? Sometimes you close your eyes to see what you feel. And that's the same thing in needlework, hand-eye coordination. When I was little, my grandfather grew tobacco, and we worked on a tobacco farm. And one of the things we did was strung tobacco. So you put a stick on a horse, someone passed you tobacco, and you string it this way, that way, this way, that way, till you get to the end of the stick. You tie it off. There's a special knot we use. You pull it and snap it, and someone takes the stick and runs it up into the tobacco barn. Well, when I went to medical school, we were given a tube about this big around, about that deep, and we had to practice doing sutures in this tube, hand-eye coordination. And one of the stitches that we had to learn was the same stitch that I did as a child and a teenager on the tobacco stick. It was so funny. I called my mom and my grandfather, and he said, you're paying all of this tuition money and you're tying tobacco in medical school. But it was really funny.
I totally love it. I am looking at an amazing array of plants behind you. Why gardening?
I find gardening very soothing, and it's a religious experience. You see the wonder of it all. You start with a seed, you end up with a fruit, or you end up with a herb, or you end up with a flower. I love to cook, and I love to cook with my own herbs. I love making my own herbal oils, my own herbal vinegars, and we have a little bit of everything here. This is my joy, just to be out and digging in the dirt and letting everything else go by the wayside.
Talk about fishing. When did you start and why you fish?
I've been fishing my whole life. I was a Brownie Scout and a Girl Scout, and we learned to fish in the Scouts. I learned to fish with my grandfather. And again, that cadence. When you are relaxing and the quiet, I'm not one that fish, I don't fish with a radio, I don't fish with any noise and so forth, but the cadence and the privacy of fishing and being one with nature, whether you catch something or don't catch something, is very calming. You can think, you can make some decisions, you can reflect on decisions that you have made just in the quiet. Sometimes people ask me, well, when did you decide to become a doctor? Why did you decide to become a doctor? I always wanted medicine. When I was a child, I was a very inquisitive child, and a lady died in my mom's hometown. And I asked, well, what did she die of? And I think I was about 12 or 13. And they whispered, she died of female problems. And everything was all hush-hush. So, well, what does that mean, she died of female problems? And they were appalled that a child would ask adult that type of question. But I was 12, 13, now coming into my young womanhood. I'm like, what do you mean she died of female problems? I'm a female, is it something I'm gonna die of? No one could give an answer or would give it. Everything was very hush-hush. Preventive health care, comprehensive health care, it was unknown. And it was unknown for several reasons. One, there was poor access. There were few black doctors. There were a lot of superstitions about medicine, and people just did not know and didn't want to know, and that irritated me. So when people say, when did you want to become a doctor? I don't remember ever wanting to do anything else other than fly a plane, and I still haven't learned to do that yet.
You played an integral part in the whole COVID vaccination and testing and stuff. Talk about that and what that meant to you as a doctor.
When COVID hit, I don't think we realized that we were in the middle of history being made. I think if Bond had not played the role that it had, thinking about the number of lives that we touched, of people that we were able to convince to get vaccinated or get tested, the numbers would have been much worse in Leon County. We were able to save lives, and that's what I reminded the staff of every day. We were actually saving lives, and we did it with a team spirit, and we did it with a sense of collaboration. We worked with hospitals and colleges and football teams and the National Guard and the state and so forth. But we weren't just at the table, we were leaders in this response.
We're prepared to open a third building.
Let me tell you a little bit about Bond Community Health Center. Bond provides health care, comprehensive health care to anybody who needs health care, not just the uninsured. We take every insurance. We provide care for adults, for children. I want people to understand that it's not just some little clinic somewhere. You've probably seen our Pink Mobile Unit. We're out in the community, and we're out in the rural parts of Tallahassee and Leon County. We do a lot of education. We do a lot of research at Bond. We were involved in Operation Warp Speed years ago when we were talking about how we were going to treat COVID. That's a big deal. So we're busy. Come visit us. I want you to come see what we do.